Imagine a highway that suddenly becomes blocked. Cars stop moving, traffic builds up, and everything beyond that point slowly shuts down. Now imagine the same thing happening inside your body, because that is exactly what occurs when an artery becomes blocked. Arteries are the highways of your circulatory system. They carry oxygen-rich blood from the heart to every vital organ in your body: the brain, the heart muscle, the kidneys, and beyond. Every second, your cells depend on this constant flow of oxygen and nutrients. Without it, they cannot survive. An arterial blockage does not happen overnight. It begins silently, often years earlier. Inside the artery wall, fatty deposits known as plaque slowly accumulate. This plaque is made of cholesterol, inflammatory cells, and calcium. At first, the artery simply becomes narrower. Blood still flows, just not as smoothly. Most people feel nothing at this stage. The real danger begins when the plaque becomes unstable. One day, the plaque ruptures. The body reacts instantly, as if it were an open wound. Blood platelets rush to the site, forming a clot. But instead of stopping bleeding, this clot blocks the artery completely. Blood flow suddenly stops. Without blood, oxygen can no longer reach the tissue. Within minutes, cells begin to suffocate. In the heart, this causes a heart attack. In the brain, it causes a stroke. This is why arterial blockages are medical emergencies. Time is life. The symptoms depend on where the blockage occurs. In the heart, chest pressure or pain, shortness of breath, pain spreading to the arm or jaw. In the brain, sudden weakness on one side of the body, trouble speaking, loss of vision or balance. Ignoring these signs can be fatal. The most dangerous part is not just the blockage itself, it's what happens afterward. Damaged tissue triggers inflammation, the heart weakens, the brain loses function, and once cells die, they often cannot be replaced. Several factors increase the risk of arterial blockage: high blood pressure, high cholesterol, smoking, diabetes, obesity, chronic stress, lack of physical activity. These factors damage the artery wall and accelerate plaque formation. Doctors use several tools to detect blockages: blood tests, ultrasound imaging, CT scans, angiography. Early detection can prevent life-threatening complications. Treatment depends on severity. In mild cases, lifestyle changes, diet improvement, physical activity, medications to thin the blood or lower cholesterol. In severe cases, angioplasty to open the artery, stent placement, bypass surgery. The goal is always the same: restore blood flow before irreversible damage occurs. The good news is this: most arterial blockages are preventable. Healthy food, regular movement, stress control, and early medical checkups can protect your arteries for decades. Your arteries remember how you treat them. An artery blockage is silent until it isn't. Understanding what happens inside your body gives you power. Power to act early. Power to choose better habits. Power to protect your life. Because sometimes, knowledge doesn't just inform, it saves lives.